Hi. Hello, my beautiful people. How are they? As for me, I'm doing well. I'm okay. I'm fine. The fact that you are there, I know that I am here. I am fine. Wow, I want to bless God for everybody that have subscribed to my YouTube channel. I also want to bless God for that person that is watching me right now, because I know you are going to subscribe. You are going to hit the subscription button and the notification bell. I salute you. I said God will bless you. In fact, anything that you put your hand on, it will work like never before. This prayer cannot fall on the ground. My subscribers, please subscribe. Today we are going to be talking on gonorrhea. Yes, gonorrhea. Their causes, their signs and symptoms in men, in women, how it affects men, how it affects women, their treatment, and those things that we can put in place for gonorrhea not to reoccur. Because many people have written me, they have messaged me on WhatsApp and on Facebook telling me their experience with STDs, and told me that especially gonorrhea, they have gone to the hospital, they did tests, they took medications, but the gonorrhea reoccurred after a while. So today we are going to be talking basically everything on gonorrhea. This is not the kind of message you will want to skip, or you will want to say no, you will not watch. You need to watch it like right now. Don't skip, because at the end of this video, I don't know, maybe at the end or at the middle of the video, I am going to be telling you those things that whenever you do them, those habits that when you practice them, gonorrhea or vaginal infections will kiss goodbye forever. I remain your girl Marvel, all the way from UAE, your wonderfulness, bringing to you all these health tips and talks for you to stay healthy. Hi, my people, this gonorrhea, it don't show people. You know, it's your ha. So what is gonorrhea? Okay, one, gonorrhea is a bacterial infection, and the name of the bacteria that causes gonorrhea is called Neisseria gonorrhoeae. That's the name of the bacteria. Gonorrhea is an STD, which means that you can get it through sexual contact from an affected person when you have unprotected sex. Number 3, gonorrhea, it affects people when they are still in their youthful ages between the age of 15 and 25. Those youthful people are still at very high risk of getting gonorrhea. So how is gonorrhea spread? Gonorrhea is spread from person to person when you make love with somebody who is affected with gonorrhea and that sex was not protected. Okay, a pregnant woman could pass gonorrhea to the unborn baby during childbearing, okay, during delivery. Okay, so we are going to be talking on the affected places that is being affected by gonorrhea. Number 1, gonorrhea affect the eyes. Okay, yes, gonorrhea affect the eyes. Secondly, gonorrhea affect the throat. Thirdly, gonorrhea affect the penis, the urethra, yeah, so the urethra in a man, he knows it's in the penis where the urine passes. It affects it. Yeah, it affects the anus. It also affects the vagina, and it affects the female reproductive organs. When I talk about the female reproductive organ, I'm talking about the womb, I'm talking about the fallopian tube, I'm talking about the ovaries. Yes, it affects all of the female reproductive organs. So my people, gonorrhea is not something that you are going to joke with. So we are going to be talking next on how can I reduce the risk of getting gonorrhea. Listen, oh, how can you reduce the risk of getting gonorrhea? It means that if you are watching me now, you don't have gonorrhea. How can you protect yourself not from having gonorrhea? First, the number one confident thing that if you put this one in place, you no go ever and ever get that, is no sex, no intercourse with nobody. Because the only person you can trust, it's yourself. Whether you are married, whether you have a fiance, whether you have a girlfriend, you don't know what they do behind you. So the only one thing that you can do for you not to get gonorrhea is no abstinence. But people, these youths will get that nowadays. They don't fit talk. So the method there, you know, go look at other method the way if you work out. Yeah, so no sex. So since that these our youths nowadays they know if you go without sex. So what are we going to do? We are going to look for other methods. Another method is the fact that you have to having a long-term monogamous relationship. Yo, that big grammar. Having a long-term monogamous relationship means that you have to have a long-term relationship with one person. You can have a monogamous relationship with many people. Just say within 1 year, you date 3 persons, only them. It still puts you as a threat of having gonorrhea, okay? Yeah, so you are going to have one relationship in a longer time. Why not lifetime? Yes. Or if you cannot do, you can use a condom. Yeah, a condom is also there to prevent you from having this. So my people, as you are just joining me, as you're coming live, you're coming on my YouTube page, as you are just stumbling on this page, please subscribe, okay? So that I'll be bringing to you lovely health tips. Yes, it's your girl. So now we are going to be talking on signs and symptoms of gonorrhea in men and in women. Please stay keenly to these signs and symptoms, because some of you watching me, you might be having gonorrhea, because most of these signs and symptoms are mild. Yes, are mild, that it makes you not to feel anything, so you think that you are not sick. But maybe from these signs and symptoms, you could say, hey, I'm experiencing this. She talked about this one, she talked about, I'm experiencing it. Maybe it's gonorrhea. So you should pay attention, okay, to these signs and symptoms I'm going to be talking about now. So signs and symptoms of gonorrhea in men. Number 1, men, they will always experience this burning sensation or pain during urination. If you see person where they suffer from this particular one, you go bow. See, you go here shouting. I talked about it in my last video. See, they can shout for Africa because the pain is not easy. Remember, on the beginning of this video, I talked about where this gonorrhea particularly affects in our body, the position. I talked about the urethra. Okay, if you have a penis as a man, that tube, or I don't know as I fit talk, that road where piece the pass for your penis before you can come out, they call and say wait, urethra. So when you have gonorrhea, this bacteria, because it affects the urethra, it lies between the not be in between, it lies within the urethra. So wait till it happen. As it lie for that place, the place go become, it go get sore small wounds. Okay, it will give you small. You don't ever see picky wey get crocro for your head. Yes, it will give you small wounds along the urethra. Yes, you don't ever get small wound then water touch them. It's very painful. So that is the reason why most men that have gonorrhea will experience this burning sensation during urination. Okay, sometimes it's mild, you just feel small pain. Sometimes it's very severe. Okay, so please, if you're having painful urination, don't overlook it. Go to the hospital and do a test. Sometimes men also see this yellowish or whitish discharges from their penis. Okay, yes, they see it. Please, if you're having that experience, don't overlook it. Sometimes their testicles become swelling, that two balls and so for your penis. Sometimes they call it testicles. Sometimes they become very swollen and painful. So please, if you're having that experience, don't overlook it. Okay, because it could be very dangerous. So we are going to be talking on the signs and symptoms in women. Oh boy, women, they are no easy. Yes, we are going to be talking on the signs and symptoms in women. Most women are asymptomatic. Yes, most women are asymptomatic. What do I mean by that? Women can stay for months, years, without experiencing any signs and symptoms. So be careful. You can be having gonorrhea as a woman without knowing, because it can stay in your system for a very long time without posing any sign. Okay, yes, but the following symptoms can be seen after a while. You have vaginal discharges. You have this watery, slippery green or yellowish vaginal discharge. It's you will know that it's not normal, because normally women have normal discharges. Okay, it is creamy in nature, in color, it is odorless, it has its own particular odor. Yes, but with gonorrhea, the odor is very offensive. Yes, okay, so you will have anal itching. Your vulva will be so itching. Okay, in between your anus and your vagina, you will experience a lot of itching. Yeah, because remember I told you that the bacteria lives in the anus, it lives in the vagina. So the fact that your anus itches too much should be a call for concern, please. Okay, you will have sore around your anus, you might have sore around your vagina, you might have sore around your labia minora or majora. Yes, you might have sore around your labia majora. Yeah, the bigger one, the one outside. These two things, and so for woman, the vagina, where they do for outside, they look you so. They call and say labia. You might have sore around your labia. Yeah, small wounds, very painful. You experience the pains when you want to pee, when you want to go to the toilet. Yes, some of you will call it sugar. I get cratching. It's a sign of gonorrhea. Please take it serious. So I'll be bringing the pictures. As I'll be talking, you'll be seeing the pictures. This is a picture of a woman that is suffering from gonorrhea. Look at the picture very well. Okay, yeah, so I'll be talking about the next sign. I'll be talking about pain, lower abdominal pain. You will experience lower abdominal pains a lot. You will also experience pain during intercourse. Yes, are you that woman that whenever you're having intercourse with your man, you feel very, in fact, you feel a sharp pain? Yes, yeah, you obviously have fever. My people, fever not be sick. Oh, Some people, when you have fever, you go to the hospital. Anyway, let me not talk about this because there is a video I'm preparing, I'm working on fever, so that whenever you have fever, you will not take paracetamol. If you know what paracetamol can do to your health, whenever you have fever, you will not want to take paracetamol. Heavy period. Sometimes in women, they will experience heavy bleeding during menstruation. If you know your menstruation was not like that, very heavy and painful, please go to the hospital and do a gonorrhea test. Remember, I told you that one of the places that gonorrhea affects is the female reproductive system, and the womb is part of the female reproductive system, and menstruation comes from the womb. Obviously, that is why you will experience a heavy bleeding. Okay, some women will also experience painful urination. Yeah, because along the urethra also, these bacteria habits, so obviously they will be sore along the urethra, so the woman will also experience painful urination. Okay, so how can you be diagnosed of gonorrhea? If you go to the hospital or you visit any health facilities, they will tell you how you can do your gonorrhea test. Okay, yeah, they will tell you how you can do your gonorrhea test. They can either take swab from your vagina, they can either give you make a swab from your vagina, from your throat, from to make the test. And if you are found positive, don't kill yourself, because gonorrhea is curable. I know somebody will ask me, can gonorrhea be curable? Yes, and yes. Gonorrhea is curable. You can actually cure gonorrhea with antibiotics and some good home practices that you will inculcate. So now we are going to be talking about the treatment of gonorrhea and those habits that you could do as a woman for gonorrhea not to reoccur. So that these vaginal itches as a result of gonorrhea, that you always have vaginal itches as a result of gonorrhea, it will not reoccur. When you go to the hospital, you are found positive of gonorrhea, the doctor will place you on series on antibiotics. Please, the antibiotics that they'll be giving you for gonorrhea will not be the antibiotics for somebody suffering from syphilis, because these are two different strengths of bacteria. Okay, so if you go to the hospital, the doctor might either place you on ceftriaxone, shots of injections, IM through your buttocks, or they might give you tablets, maybe azithromycin for gonorrhea. And the doctor, due to your severity, the doctor might decide to place you on a week treatment, 2 weeks treatment, or a 3 weeks treatment, depending on your severity. Okay, how can you stop the reoccurrence of vaginal infections and gonorrhea, most especially? Number one, as a woman, please make sure that if you're treating yourself for gonorrhea, discard, in fact, throw away, burn all your inner ways, all your undies, your pants, most especially. You cannot be treating yourself for a bacterial infection that the bacteria is found in your anus and in your vagina, then you are keeping the same pants that you were wearing before the treatment. What are you thinking? Obviously, when you wear your pant rubs with your vagina and your anus. Normally the bacteria will be on your pants. Yes, so you cannot keep those pants. You have to throw them and get new ones. Secondly, as a woman, please, you need to be using panty liners. It will help you a lot. Thirdly, you don't need to douche all the time as a woman. It's not a good habit. You think that it is hygienic, but it is not. You may want to douche maybe when you pee or you stool or you may want to douche that time, but you cannot just sit. You are not just from urinating, you just sit and you said, okay, let me go and douche, and you douche 20 times in a day. It is not a healthy habit. What happens? You kill the normal flora of the vagina, thereby exposing it to infections. Yes. So please, douching all the time is not encouraging. Those of us that are using this flushing toilets, as we call them, please remember I said this bacteria is around the urethra. It's around the urethra. It means that if you pee is coming from the urethra, physis is coming from the anus, and we have talked about it, that this bacteria lives around this area. If you visit the toilet often, maybe when you're douching, maybe you're cleaning your anus or you're douching, obviously some of the bacteria will fall in a toilet pot. And when you come again, you stool, and those the water from the toilet pots keep touching you. What happens? You reinfect yourself. So please make sure that you have La Croix all the time in your toilet. After you visit the toilet, you have to pour La Croix in your toilet, thereby avoiding reinfection. Please practice the habit of sitz bath all the time. No, I can say maybe once a week. As a woman, you need to practice sitz bath. What is sitz bath? Sitz bath is when you take warm water, you put it in a small bucket, you may want to add salt in it, then you just sit on it for the vapor to be coming out. And when this vapor is coming out, it touches your anus and your vagina. It's very, very effective. It helps to prevent women from vaginal infections. So you may want to practice sitz bath once a week. It's very, very helpful. Please, my people, so you want to do that. So we have come to an end of this topic. Please share this video. There is somebody suffering from gonorrhea somewhere that needs this video to be cured. There is someone somewhere that has had reoccurrence of gonorrhea and the person is asking questions. This video will help such a person. Please like, comment, subscribe. My dear, with such a wonderful topic, the only thing that you can do to me for God to bless your soul now is just for you to subscribe. Click the notification bell by the side so that whenever I come up with good videos like this, you are going to be notified. One love. Until we meet again on my next video, have a blessed day.